Now we are joined by a Democrat who has been openly critical of the Senate health care bill, Dr. Howard Dean. Governor Dean, welcome to the program from Vermont. The question is whether this is in keeping with the president's principles on health care, the way he campaigned, the promises he made in terms of how he would lead an effort to get health care reform, including the public option, which you heard David Axelrod say he supported. Did he fight for these principles, in your view, the way he should have?
Well, look, I think this is not universal health care, it's about 94%. But he certainly tried very hard. But I think the absence of having choices for Americans, real choices, including a system like Medicare, which only has 4% of its expenditures go to non-health care expenditures, as opposed to 25 or 20% in this bill that's just about to pass. I think that's a big loss. And the bottom line is, in an unseemly scramble for votes that have nothing to do with long-range public policy, we have really essentially cut out the idea that Americans will have a choice of a different kind of insurance system, the same kind of insurance system people over 65 have, the same kind of insurance that veterans have. A lot of us would have liked to have that system because it's so much more effective and, frankly, so much more satisfactory than what we see in the private
You say an unseemly
sector.
Scramble for votes. For Senator Lieberman, they had to give up Medicare expansion or else he would not have voted for it. For Senator Nelson, much the same thing, and also including these restrictions on whether abortions can be paid for in a federal exchange of private insurance plans. Given this rush and the compromises made for votes, do you stand by your words this week that you would not vote for this bill?
I would certainly not vote for this bill if this were the final product, but the House bill is quite a good bill. This bill has improved over the last couple of weeks. I would let this thing go to conference committee and let's see if we can fix it some more, because
what needs to be fixed specifically?
Well, first of all, the cost controls need to apply to hospitals. Second of all, we really do need some kind of a public option. At least allow the states to have a public option, a real public option, because some senators have said, well, there's a public option to the bill. Well, that's not really true. The public option in this bill is allowing the federal government to negotiate with private insurance companies. That's not a public option.
But, Governor, do you really expect the White House to fight for any form of a public option at this stage of the game?
Well, obviously, we've been very disappointed by that. We don't think that there has been much fight in the White House for that. Another big piece that needs to be fixed is I don't think we ought to be able to charge older people 3 times as much as you charge younger people. The House has twice as much. That's still too much. So there's a lot of things that need to be fixed. But if they are fixed, you may actually get the foundation of a bill coming out of the House. If most of the House provisions survive, then we could have a bill that we could work with. But this elimination of the public option is a real sticking point, because that, in fact, is how you really save money and bend the curve in expenses.
But I just want to be clear. So your advice, former chairman of the party, to House and Senate members who come to the point of a final bill, if it does not have a public option, your advice would be vote no.
I think it's got to have a public option, at least allow some of the states. Now, there are 2 countries that have done this without a public option, Switzerland and the Netherlands, but they treat insurance companies as public utilities. That's what we would have to do, and I don't have an objection to that. My concern about the public option is not ideological. But I just think a 30-year fight with the insurance industries over every little detail about how they're going to control costs is something that, judging by this past week when the insurance companies essentially wrote the bill, is not likely to happen.
Governor, my question was, without the public option, is your position say no to the bill?
My position is, let's see what they add to this bill and make it work. If they can make it work without a public option, I'm all ears. I don't think that's possible.
The question of compromise is a very interesting one. Back in 1995, in the wake of the collapse of health care reform, you said that you made a mistake. You and others made a mistake by not compromising on health care with the Republicans. And Vicki Kennedy, the widow, of course, of the late Senator Kennedy, has penned an op-ed this morning, and this is what she writes in the headline, "The Moment Ted Kennedy Would Not Want to Lose." Ted knew that accomplishing reform would be difficult. He predicted that as the Senate got closer to a vote, compromises would be necessary. Coalitions would falter, and many ardent supporters of reform would want to walk away. He hoped that he wouldn't do so, that they wouldn't do so. Ted often said that we can't let the perfect be the enemy of the good. He also said that it was better to get half a loaf than no loaf at all, especially with so many lives at stake. You heard David Axelrod essentially say legislation like this is so difficult, you can never achieve perfection. In the light of what Vicki Kennedy says, do you have a different view of whether compromise has been worth it here?
I think there's been an enormous amount of compromise. I think the compromise, frankly, has been too much. Here's the basic problem, and I said it before and I'll say it again. We have set this nation down a course where we're going to do this through public insurance. Private insurance. It is possible to do that. 2 other countries that I know of do that exclusively in private insurance. It is very, very difficult. It is very, very expensive. We are nowhere near where Switzerland and the Netherlands are in terms of the regulatory apparatus on the private insurance industry. So I just think this is going to be a very, very difficult, tough row to hoe. She also wrote in that editorial, we need to be sure we get this right, and I agree with that.
The politics of this are part of it, and people have talked about it. Indeed, your opposition this week, which I had mentioned before, set off something of a revolt within the party, led to some strange political bedfellows for you. Senator John McCain on the floor of the Senate said this.
If you live long enough, all things can happen. I now find myself in complete agreement with Dr. Howard Dean, who says that we should stop this bill in its tracks. We should go back to the beginning and have an overall bipartisan agreement. Dr. Dean, I am with you.
How do you react to that?
I think, the Republicans' behavior has been reprehensible. They haven't lifted a finger. They have really put their party in front of their country here. They could have made this bill a better bill, but they chose just to kill the bill because they thought they did do that for political reasons. First, and I don't believe there's a bipartisan compromise possible. As David Axelrod said, the Republicans of today and the John McCain of today is not the same, not even the same as the Republican Party of 8 years ago, and it certainly isn't the same as the Republican Party my father was in until the day he died. So, I respect John McCain, but he wouldn't be the first person who twisted my words around and used them for something I had no intention of endorsing, which is the Republicans' behavior in this bill.
Given your own fight within the Democratic Party, indeed within the Obama administration, do you intend to stay in the Democratic Party?
Of course. Absolutely. I've said I would vigorously support the president's re-election in 2012. I have every intention of doing that. Look, whatever fights we have inside the Democratic Party, and this is a very sore one, because I really do think we're going down a track that is not going to be helpful in the long run without some really brutal fights ahead of us. But President Obama, first of all, has had a terrific record on the environment. Despite his struggles, I think he's actually moved the dialogue in Copenhagen forward. He restored America's good name around the rest of the world. I mean, he is so far ahead of whatever the Republicans might choose to do in 2012 that, of course, I'm going to support President Obama.
The columnist with the Washington Post, E.J. Dionne, has warned of, quote, political catastrophe if Democrats still turn and keep turning on one another over health care and other issues. What will be the political consequence of this health care debate and the compromise that's been achieved?
Look, first of all, I hope this isn't the compromise that's been achieved. I think we have yet to see the compromise that we could achieve. Secondly, this isn't personal. I like David Axelrod. We've actually talked back and forth through the week. As I have with other people in the White House as this has gone on. We're all in the same family, but this is a serious business. We have seen, essentially, a destructive political process in Washington where the insurance company lobby essentially wrote a good piece of this bill. Now, I'll admit that they have pulled back in this past week. There are some things in this bill that weren't in there a week ago that make it a better bill. But this can't be the final version of this bill. It simply sets us on a track in this country which is expensive and where we're going to have lots more political fights, where a few senators who are beholden to the insurance industry can hold up the kind of real progress that we could have made had we passed what the president suggested when he was running for president.
So, final question for you, as for David Axelrod. Do you think health care reform, as ultimately passed by this administration, will end up costing Democrats seats in the House or in the Senate next year?
It's hard to know without the final result. I think if this bill doesn't go into effect until 2014, it'll be so complicated that the Republicans will make it a target, and we'll have a hard time explaining it. Another benefit to the public option, especially to the Medicare deal that was on the table a week ago in the Senate, is that people could have gotten in large numbers, 4 or 5 million people, within 2 or 3 months after the president signed the bill. That would have gone a long way to making sure that the American people understood it, because their neighbors would have health insurance that didn't have death panels, where you were allowed to charge your doctors, and with all this Republican nonsense propaganda would have been put to bed by the American people.
All right.
That would have made 2010 a lot easier for us.
Governor, Dr. Chairman Dean, thank you very much. We'll send some of our snow up your way.
Thanks, David.
Up next, the